You have 10 minutes.
Thank you very much, Lasky and Corla. Very much welcome the opportunity to discuss this matter, and the industrial action taken by the INMO and the PNA is clearly creating significant challenges and disruption for the health service, and more importantly has created a very worrying time for patients and their families. I want to acknowledge that I know this is not an action that nurses and midwives take lightly, and that this is a situation that needs to be resolved, and the government remains steadfast in wishing to resolve the matter. There is no monopoly on political support for our nurses. I'm privileged as Minister for Health to meet incredible nurses and midwives on a daily basis. I meet patients on a daily basis who remind me of the excellent work our nurses do across this country. So this is not a debate about who cares for nurses more. This is actually a debate about how you resolve an industrial relations dispute in the context of a public service stability agreement, which I believe most, if not all, parties in this House profess to support. Because it must be remembered by everyone in this House that the government and the unions, including those involved in the disputes, did sign up to a 3-year public service pay agreement. Honouring agreements does matter. The Public Service Pay Agreement expressly prohibits cost claim pay increases during the lifetime of the agreement. That is what was signed up to. So it is within that space that a solution must be found. Deputies have already heard in this House how the Public Service Pay Agreement takes significant steps towards pay restoration. That agreement commits to seeing significant increases in pay by 2020, and nurses and midwives can expect to see their share of these increases beginning this year. Reductions for pay levels up to 50,000, which includes a very large proportion of the nursing and midwifery profession, will be fully unwound by the end of this year. This represents a wage increase of between 2 to 2.5% on average across the sector, with new entrants and lower paid professionals benefiting the most from these changes. The Government is united in its support to unwind pay reduction measures introduced under FEMPI legislation. The agreement was sought in full cooperation and collaboration with public sector unions, including nursing unions. We are eager to come to a fair and satisfactory solution for all parties involved that preserves the integrity of all elements of this agreement. This does put us in a difficult position. How to reach a solution which respects the Public Service Stability Agreement and other unions who do represent other hard-working public servants who are not engaged in industrial action. I think there is an onus on those in this House who say that we should just support the claim being made by the nursing unions to answer the question to their constituents who work in other elements of the public service. Do you believe that they too should be treated equally in that regard? But just because something is difficult, and this is clearly a difficult situation, does not mean that we give up. Far from it. There have been repeated attempts to resolve this dispute, none of which have borne fruit yet, but I do stress the word yet. I do believe that there are solutions to be found, but it will require innovation and imagination on both sides. On Monday, myself and my colleague, the Minister for Finance and Public Expenditure and Reform, did issue a statement on the current nursing dispute. And this statement made it clear that the Government continues to be willing to engage in talks on a range of workplace-related issues to try to resolve this dispute. The statement called for immediate engagement in the context of the current dispute with relevant unions. Unfortunately, I regret that this engagement has not taken place, and the Workplace Relations Commission remains available to facilitate all the parties in this regard. Issues of recruitment and retention in our health service, which unions have claimed are at the very heart of this dispute, must be taken seriously. We fully accept that the numbers of highly qualified nursing, midwifery and medical professionals leaving the country is an issue that requires to be addressed. That is why our government engaged the Public Service Pay Commission to look at roles in the public sector where recruitment and retention has been identified as issues. If we didn't take this issue seriously, we wouldn't have set up a specific module of the Public Service Pay Commission to examine these issues in the health service. The Commission itself featured members with a wealth of experience in trade union organisations, including people with experience as members of SIPTU, Impact and the Congress of Trade Unions. Nursing and midwifery was among the first professions, as I said, investigated by this independent commission. And the Commission's findings were clear, they were published and they were accepted in full by government. It said, after an in-depth assessment, the recruitment and retention issues were a cause of concern, but that pay could not be found to be the one determining factor, that it was a complex issue with many aspects, and therefore one that requires a range of solutions. This does not discount the equally clear actions recommended in the report that I, as Minister for Health, the HSE and the Government are considering to improve staff retention and recruitment within the nursing and midwifery profession. In addition to the benefits nurses and midwives can expect to receive from the unwinding of pay restrictions under this pay agreement and the correction of salary scale issues for post-2011 new entrants, the Government has agreed to the Commission's recommendations of a 20% increase in local and qualification allowances for nurses, as well as accelerated promotion for staff nurses to the senior staff nurse level. Despite the union's recent rejection of these findings, the Government is hopeful that through further dialogue and clarification, these recommendations can be accepted and can be put into action now this year for the benefit of our nurses and midwives. The industrial action taken by unions is having a significant impact on our hospitals and our healthcare facilities, and I must say I think the decision to escalate it to include disability services was unwarranted. The industrial action taken by our unions is really impacting in a very real way, because by the end of today's work stoppage, over 37,000 outpatient appointments will have been cancelled since the strike action commenced, and it's expected that over 6,000 inpatient and day case appointments will have been cancelled. These are not just numbers. Behind each of these lies worry and concern for patients and their families. Looking ahead to next week, there are a further 3 days of industrial action planned, with more cancellations needed. In addition, the cumulative effect of these 3 days of industrial action will also be adding to the stress of an already strained system. So be under no illusion that this is a dangerous situation and that patients would be put at risk. While the disruption is creating a worrying time for many people, contingency plans have been activated by the HSE to ensure urgent life-saving care is maintained throughout this industrial action. I want to recognise that the unions are cooperating in relation to contingency planning in these regards, and these plans are being modified and refined daily to ensure this essential coverage is delivered during this dispute. I understand the strength of the union's concerns, and I fully recognise that to have a first-class health service, this requires staff who have first-class support. It is regrettable that the unions feel that pay reforms are not coming to action quick enough, but proposed industrial action and ongoing industrial action is not the answer. We are fully committed to coming to a satisfactory solution for all parties involved, in accordance with the terms of the Public Service and Stability Agreement. I hear a lot of people saying that the solution can be found within the agreement. I think there's a duty on people to outline how exactly they bring that solution about, because any solution to this dispute must be affordable and fair. Affordable to the taxpayer, but fair to all other public servants, fair to all the other hard-working public servants, including nurses and other unions who are working today, who have faithfully observed the parameters of the Public Service Pay and Stability Agreement. As the stakes in this dispute, Lasky and Corla, are high. I mentioned recently that this situation is like a tightrope, and it is. The Government must maintain a responsible and prudent handling of our public finances, including public service pay, because without it, all future pay agreements may not only be at risk, but may also become unaffordable. To agree to the demands of the unions as they currently stand would tilt that handling of the public finances into an unsustainable spiral. This would damage our economy, our health service, and ultimately public servants, including nurses, who we wish to support. It is essential that industrial action comes to a halt as soon as possible. Our Government is sincere in its offer to want to talk and engage with nursing unions to reach a resolution to this dispute, and I am confident that this can be accomplished through further dialogue and engagement. I really hope after today's stoppage comes to an end that there's a real intensity of engagement as we work together to try and avoid further disruption. I'm sure many of us have had the opportunity to see nurses on the picket. People have bepped their horn in support. But what struck me as I passed were the chants that I heard proclaiming the need for safe staffing. While the key staff essential for running the services in the building behind them are outside on the picket line, there has to be a better way to do our business. I believe that that better way lies in the industrial relations machinery of the state, the Workplace Relations Commission, the Labour Court, and not the picket line. The solution will not be found here on the floor of the Dáil. The solution will be found using our industrial relations mechanism. We want to use that mechanism, Lasky and Corla. We want to come to a solution. We want to find an innovative solution. But we also want to honour an agreement that most parties in this House claim they fully support, which is the Public Service Stability Agreement and the commitment we gave to all of our public servants, including nurses and midwives, under that agreement.